This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, and welcome to Common Health, an audio series brought to you by the Virginia Community Healthcare Association. Common Health brings together voices from around Virginia and beyond to discuss all aspects of individual and community health and well-being. I'm Adrienne Harden, Virginia Community Healthcare Association's registered dietitian and nutritionist. Today's episode is one that is near and dear to my heart: food access. In an ideal world, we would be discussing how wonderful it is that everyone has access to healthy, affordable food, a goal I think my guest and I share. But that goal is still ahead of us, and we're here to understand why. Joining me today is Eddie Oliver, the Executive Director of the Federation of Virginia Food Banks. His career has been dedicated to food access for quite some time. Prior to joining the Federation as Executive Director in 2018, he served as Virginia's State Director for No Kid Hungry and as Chief of Staff for First Lady of Virginia, Dorothy McCullough. Eddie, welcome to Common Health.
Thanks for having me.
Thank you for being here. So let's jump in. Food insecurity is something most people know exists in their community, and most have likely heard of food banks. But Eddie, I would guess that several may not know the specifics of people in their own communities who may be impacted by food insecurity, and even the full extent of the infrastructure designed to meet that need. So first, could you tell us more about hunger in Virginia?
It's really remarkable how prevalent hunger is in Virginia. It does not discriminate geographically or in any other way. We see it in rural communities, suburban communities, urban communities, and it really is defined by financial instability, which affects so many families. We see so many families living paycheck to paycheck, and that limited income is going first toward housing and then toward car payments, other bills that have debt collectors after them. And too often food is the thing that is most easily sacrificed. And so we see parents skipping meals so their kids can eat. We have grandparents raising grandchildren on fixed incomes. And just this year, for the first time in the history of Feeding America's Map the Meal Gap report, we see over 1 million Virginians have struggled with food insecurity at some point during the year, meaning they weren't always able to afford enough nutritious food for their families.
Wow, thank you for sharing that with us and giving us that framework. That leads me to ask, so what are food banks and what do they do?
Food banks got started about 40 to 50 years ago. There are 200 throughout the country and 7 here in Virginia. I work on behalf of those 7, primarily to do government relations, but we have a variety of different collaborative initiatives we undertake. Food banks are, I often describe them as a Walmart distribution center, which is the huge warehouse where everything comes in to then go out to Walmart stores. It's not necessarily where you would go shopping. It's not an individual Walmart store. That's what we describe as a pantry. So food banks have in Virginia over 1,150 different pantries we distribute food to and work with through programming. We have an additional 800 to 900 distribution partners in program sites like schools, where we will help do one-time distributions, weekend backpacks, school pantries, those kinds of things. We work with retailers, manufacturers. That's really our core base of support, getting donations from the retail sector When grocery stores have more food than they know they're going to be able to sell, we partner with them to rescue that food safely, move it into our warehouses, and then get it out to where it's needed most. That's really the traditional bread and butter, so to speak, of food banking. But we have a lot of innovative initiatives, as I mentioned, that we've been working on in recent years to be more targeted with how we are meeting the nutritional needs of the communities, food insecure communities in Virginia, and reach the really underserved hidden populations.
Very important, Eddie, to highlight that. And thank you for giving that example, a concrete example that we can resonate with how the logistics and operations are, and for how these massive amounts of food can get to people who need it the most. So you said something important. You talked about these other innovative upcoming programs and things you all are working on. And we know that food banks aren't the only programs you all operate, but these might be a little less familiar to folks outside of the food world unless they interface with them. So, for example, a few programs we encourage here at VCHA in relation to our health centers are our food as medicine programs and also food pharmacies. So let's start with food as medicine. And, this is something I focus on a lot in my work as a dietitian. And we call it the FAM program, FAM, because of how, the Anthem Foundation helped start this program with us at VCHA. So thanks to them and their funding, we were able to have this program and offer that to our patients in our health centers. So for you all, when was food as medicine, or food is medicine, as we hear it also referred to, added to the Federation's approach? And what's the value to Virginians experiencing food insecurity?
We really got strategic at a statewide level with food as medicine about 4 years ago. We all came together, the 7 food banks, to co-design a strategy for the whole state. And that included hiring someone at the Federation to lead the work. We talked to representatives from throughout the healthcare system, our pantry system, and individuals experiencing food insecurity to better understand how they think about food and health going together. I think for a lot of people, it's natural. It makes sense. Sometimes food is referred to as the first medicine. And so many people have experience of going to the doctor, right? And the whole conversation revolves around what you're eating, because what you eat is so fundamental to your health and well-being. For too long, the emergency food system and pantries, there's been a perception, and in some ways it was a well-founded perception, that the food that you would get at a pantry isn't really good food, isn't healthy. It's a lot of breads, a lot of sweets, a lot of processed foods. But that just reflects the food that is found in our food system. People with money, with means, are often going to the store and selecting less healthy foods. And so that's what drives demand and what provides less healthy food. Processed foods, unfortunately, are often cheaper than whole foods, nutritious foods. And so food insecure families are forced, from an affordability standpoint, to choose less healthy foods. So we want to do something about that. And we've invested in a variety of different initiatives through this strategy. First and foremost, to improve the availability of whole nutritious foods, first and foremost, fresh produce in our pantry system. And that means more refrigeration so that these, small community-based, often faith-based pantries, just literally have the infrastructure to store nutritious foods. But there's a lot of different practices that go with that. Is the food culturally familiar to the people visiting that pantry? Have they seen it before? Do they know how to cook it? Do they know what it tastes like? Is it a welcoming environment? Are we providing language translation services if those families need them? And are we partnering for nutrition education? There's a lot of sort of wraparound strategies we can employ in partnership with our pantries to help the food insecure communities we interact with on their health journey. Additionally, there's some initiatives that are more centered and anchored in the healthcare system itself, that where if when you visit the doctor, you're being asked about your food security status, or it's you might call screening. That increasingly the healthcare system has been adopting this practice because they know how essential food security is to improved health outcomes. And they want to reduce readmissions and see positive health outcomes. But there hasn't always been an infrastructure to then what? Doctors don't want to ask the question if they don't have a solution. It's like same way you would write a prescription for a specific condition, right? So if a family's food insecure, how do we then connect them with resources? And that's what we have been working on collectively at the Federation, both through on-site programming. There are some high-need locations where patients can literally leave with a box of food and fresh produce that day after being screened, to more long-term solutions. Are they receiving SNAP food stamp benefits if they're eligible? Are they on WIC? How are we setting that individual up for food security over the long term? So that's high level, the strategies we've been focused on.
That insight is so helpful. And you address several important factors as those wraparound services to uplift neighbors and uplift community members. One thing you touched on that I wanted to ask more about is, well, there were several things, but one of them is the food pharmacies. So talk to us about how you mentioned some patients can leave or neighbors can leave with a food box that same day. Talk to us about what that looks like and how food pharmacies operate, what they are, and how they serve people in the community.
Yeah, it's certainly a novel concept, but it's been a huge part of improving access, particularly in rural communities where you may be 10, 20, or even 30 miles away from a local pantry. If an individual is visiting their doctor for a regular checkup or to treat a chronic condition where their diet is going to be critical to managing that chronic condition, having a pantry on site creates a tangible resource for that individual and directly connects what they're eating to their healthcare. So this is our fastest growing program. I think we are up near 90 different locations where we have an on-site pantry and a health clinic. As you can imagine, it's sometimes these clinics have to get creative with where they're creating a space for a pantry. You have to put in shelving, follow basic food safety protocols, put in refrigeration. But this really mitigates some of the logistical barriers that might come with having to deliver food to someone's house on a recurring basis, although that can be layered on as an additional service. Many of these folks might live in food deserts where they're just as far away from a grocery store as they are from a pantry. And so this just leverages sort of the healthcare infrastructure that we see in Virginia, again, benefiting rural communities, though we are concerned about disinvestment from healthcare infrastructure in rural communities right now. We see this as a way to just further reinforce the critical role of food access to that patient's healthcare journey.
And I can speak from experience with even our own community health centers that we serve here at VCHA. You all have several partnerships from food banks and our community health centers as well. So this work is so important and it permeates even in our immediate roles and scope. So amazing to hear how many different locations are already in health centers. And I know from what we're doing to partner, looking to expand. So hopefully more of those can expand. This work is just so incredible. And so that makes our next topic even more important to discuss. And you kind of touched on it because unfortunately we are seeing cuts to this food safety net. The most recent cuts were included in H.R. 1, the large legislative bill that passed this summer. What was in that bill that affects food insecurity, and what impacts are you anticipating here in Virginia?
Yeah, HR1, or the so-called Big Beautiful Bill, was by far the largest cut to federal nutrition programs in the history of the country. We anticipate that more than 400,000 individuals in Virginia will see either some or all of their SNAP benefits cut as a result of the legislation. Just for a sense of scale, there are over 800,000 individuals that use SNAP, so nearly half are affected. And it's just important to note that SNAP is roughly 9 times larger than the entire food bank network. So for every meal we provide, SNAP provides 9. Without a strong frontline SNAP program, we could never come close to meeting the need that exists in the communities. Work requirements are a big element of the bill, and this extends the age of people who are subject to work requirements. For the first time, people all the way up to the age of 64 can only receive 3 months of benefits in a 3-year time period if they aren't working. And this just raises a lot of questions about, how are we identifying someone's ability to work? Are they truly able-bodied? And we often see a lot of age discrimination in the workplace. So once you get up past 60, senior hunger is a very hidden problem in this country, and we're concerned about. There are already huge barriers to SNAP participation in the state. Only 38% of eligible seniors participate in the program. And so this is just going to create more barriers. We're worried about even folks who are still eligible won't be participating because of all the additional requirements, verification documents, what have you. Additionally, for the first time ever, the state of Virginia is going to have to pay a portion of all of the benefits that go out. So right now we're looking at an additional $350 million that Virginia is going to have to find to keep the SNAP program going. And that is going to be very hard for the General Assembly to come up with. And we're worried about that affecting other food access initiatives in the state as well.
I'm not speechless, but I'm definitely processing that impact. Borderline speechless, but wow. Thank you for sharing the stats and the gravity and the magnitude of that impact. Within that, do you have any insight on the type of timeline that we're looking at for some of these effects?
Everything impacting eligibility. So the new work requirements, there's a tightening of restrictions around, SNAP has always only been available to documented immigrants, but there's some tightening around immigration status and refugees and asylees who are eligible, including work requirements. All of those things are going into effect this month. The cost share on the state for the state's going to have to pay that coming up in 2 years, but we will have to account for that in the budget cycle that is coming up soon. And then there's additional administrative costs, which I haven't mentioned, and that kicks into effect next fall. So in a state like Virginia, which administers the SNAP program at the local level and cities and counties, some of our rural counties are looking at nearly $1 million more that they're going to have to find to administer the SNAP program. So it's just going to put a financial strain on the program itself, government services throughout the country. We could be looking at a worst case scenario where you even have states choosing to opt out of SNAP altogether because of this additional requirement. We are hopeful and optimistic that Virginia won't choose to do that. The current governor's administration has really put a lot of emphasis on finding administrative improvements, streamlining the program, improving accuracy in an effort to bring down that cost share. So for all intents and purposes, it looks like Virginia is going to stay committed to a strong SNAP program. But certainly as advocates, we have to stay vigilant, and we want to be partners with the state in ensuring the program still remains accessible to people who need it while meeting these new administrative requirements.
Appreciate that. Okay. Good to know. And I would be remiss to not mention that as we're speaking, the federal government is currently shut down. And earlier this week, the U.S. Department of Agriculture did announce that SNAP will not send out November benefits after October 31st if the government stays shut down. So there's an added layer of concern currently facing your organization, several others, and of course, our communities. All of that to say, there is so much happening right now at one time. How do you and your organization plan for or even triage some of these changes to the funding and eligibility landscape, either those immediate ones like the shutdown or even the long-term ones looking towards the future?
So this is the second significant government shutdown I've been a part of with the food banks here in Virginia, the government for their livelihoods. So think about in-home nannies who work for federal employees, gardeners. There's so many downstream effects that happen with the government shutdown. And so many of those folks are living paycheck to paycheck, meaning one missed paycheck puts them in a new status of being food insecure. And so we are being creative with as much as we can with pop-up distributions that are specifically serving federal employees. We've done some distributions for TSA workers at our airports who aren't getting paid right now. We've just crossed the threshold where these folks have missed their first paycheck. Of course, we have a huge military connected community in Virginia. Active duty military members are getting paid currently, but spouses who may work on base are not. And so there's definitely increased need there. So that's putting a strain on our resources at a time when we have already seen historically high sustained levels of demand for food assistance. We saw a 20% increase in pantry visits over the last year, and that was an increase over the year before. And so we were already pretty stretched. Then you bring the shutdown, you have federal employees missing paychecks, and now we're talking about potentially SNAP and WIC benefits not going out next month. And that is a near worst case scenario for hunger in Virginia. We are advocating to the federal government to find any and all contingency funds to make sure that folks who are relying on SNAP still get their benefits next month. Obviously, we would like to see an end to the shutdown, but it depends on, what terms, how that happens. And we don't have a position on that. We obviously just want the shutdown to end so that folks can get the benefits that they're entitled to. Eating is not optional. It's really these programs are so essential to the day-to-day lives of families in Virginia that we would really like to see the government do anything and everything possible to ensure that folks still get the benefits they're entitled to.
Important ways that you all are planning and advocating and taking action. And I really, really want to take a moment to pause and repeat what you just said. Eating is not optional. These programs are essential. Thank you for highlighting that. I think sometimes when people hear programs or they hear cuts and they're making decisions, they're not thinking fully about the faces and the lives who these programs are helping and how it is not optional. So thank you for highlighting that for us and our listeners. And how can we, regular Virginians, as supporters of your work, help either now or in future climates?
Well, now more than ever, we do need community support. So the easiest way is always go to the Federation's website at vafoodbanks.org. And if you don't know what your local food bank is, you can find it on the map there. You can get connected. You can volunteer your time. Every dollar you donate to a food bank goes farther than it would at the grocery store. So we love food donations if you happen to have canned foods available. But because of our purchasing power, our economy of scale, we can make your dollar stretch further And we are going to have to be dipping into reserves to help fill the gap that we are already experiencing in our pantries, and we'll be buying more food to address the need. And we're going into the holiday season. This is a time when we do see increased interest from the community, but also higher demand when folks are looking ahead to Thanksgiving and the winter holidays. So much of that revolves around food, right? Sitting around the table with your family, enjoying a good meal. We want to make sure everybody has what they need. And the current political situation is making that more difficult. It's hard from the standpoint, as I mentioned, an advocacy organization that where we communicate so often day in and day out about the importance of these federal nutrition programs. That's really just one small part of a much larger stuck conflict that we're experiencing in the federal government. And so it's hard to identify one easy way to get out of the shutdown. I don't think that there's going to be an easy way. We're concerned that this could last a long time just based on the lack of dialogue between the two parties. But if you can give back, help out in your local community, make a donation, that will have a huge impact.
And good to know about how those dollars stretch. I think that is very helpful when educating on how to help and what that help really looks like and how the impact can be further than even what people may have originally thought. And for you, Eddie, is there anything else that we did not discuss that you would like to address?
We're really excited about the innovative things we're doing in the healthcare space and in agriculture. Roughly 40% of the food insecure people in Virginia make too much money to even qualify for SNAP. So there's a huge percentage of the population that we are looking to serve to get them to a place where they are more self-sufficient and have food on the table on a regular basis. But we can't do that if we don't have strong federal nutrition programs like SNAP WIC and school meals. And so just underscoring the importance of advocating for those programs, ensuring your representatives support those programs throughout the year, not just in the context of a government shutdown, but that will allow us to focus more on improving health outcomes with our great partners like the health clinics, and working more with Virginia farmers to support rural economies and rescue more produce that would otherwise go to waste. There's so many, food touches so many aspects of our lives, of our economy, and we as food banks want to be creative about that, but we can't do it if government isn't doing its job. So that's first and foremost is making sure that our government leaders are prioritizing food insecure families any way they can.
When you say people make too much, what percentage, if I'm understanding correctly, what percentage below the poverty line or poverty level do people need to be at to qualify for SNAP? And so anyone above that would be making too much. Am I understanding that correctly?
Yeah, like any government program, SNAP has strict income requirements that are based on your household size, but it's roughly up to 200% of the federal poverty line in order to qualify for SNAP. But we see plenty of families, especially with the high cost of living in many of our metropolitan areas, that aren't eligible for any government programs, still struggle with food security, and have to rely on local food pantries to make that up.
Wow. Thank you, Eddie, for sharing this with us. This was very insightful. And we appreciate your time and hope to have you back. I'd like to thank Eddie for joining us today. He and his team are doing incredible work to ensure everyone in Virginia has access to healthy food, especially amidst ongoing uncertainty. I hope this inspires you to learn more about the Food Access Network in your area and find out ways you can support their mission and efforts. As always, thank you to our listeners for tuning into CommonHealth, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support CommonHealth, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, and visit our website at www.vcha.org.